Welcome to Scoop and Scale, where we dish up the science and weigh facts about mostly equine nutrition. I'm Michelle Anderson. I spent 2 decades working in equine media, and I currently create content and help veterinarians and businesses connect with horse owners through my consulting business, Cadence Marketing and Media. I'm a trail rider, dressage rider, and an at-home horse keeper.
And I'm equine nutrition consultant, Dr. Claire Tunis of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and a pony club mom.
Claire and I collaborated for years when I was the editor of an equine publication, and she was one of our regular contributors. We'd finish work, but we always had more to talk about. New products, new research, and our own horses. This podcast is an extension of those conversations. It's for anyone who wants to make better choices when it comes to feeding and caring for their own horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. While I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
With that, thank you for joining us, and we hope you enjoy the following episode. The official start of winter is right around the corner. The days are definitely getting shorter, getting longer soon, but they're getting shorter as of now. And in many parts of the country, the weather has turned cold, especially here in Central Oregon. That means horses are more likely spending more time inside barns and indoor arenas. Being inside can be hard on horses' respiratory systems, especially horses that already have equine asthma. Claire, so this is such an issue where I live, where our horses are spending more time inside. For our listeners who don't like horses living inside, I know I want my horses outside too, but winter is hard. So with that caveat, in Arizona, do you have these same issues where you're dealing with horses being in barns and having respiratory issues? Also say respiratory because I like how you say it.
Oh, here we go. Now I can't say it. Respiratory. Respiratory. That's strange. Respiratory. Yes, there we go. That's how I say it. I'm like, how do I say it?
Yeah, you don't say it like an American. At least
no, it's not. I know. It's like when I say strawberry. That's another one I don't say it. There are certain words water. That's another one. But anyway, yes, we digress. We have a lot of like mare motel pole barn type open barns in Arizona, partially because it does get so hot to allow movement of air. But I mean, not all of Arizona is like that. We forget if you go up to like Flagstaff area or elevation and it's snowing and cold and people have enclosed barns up there. So like everywhere, it's hard to make generalizations, right? But certainly down in the valley down here, our barns tend to be more open. But I certainly know some very nice concrete block barns in the valley that are, this would apply more in the summer. I mean, we don't have a lot of turnout. So some of those horses are living in enclosed block barns year round because they tend to be cooler because the blocks kind of are insulating the other way around, right? They keep the barn cool in the summer. So this would be an issue in those barns, potentially year round actually, but perhaps more in the summer because of the heat causing the ammonia smell to be kind of higher. But we'll get to that in a bit.
Yeah. And then you work with clients from around the country on diets for their horses and for performance horses. So does this issue come up with helping horse owners that are local to you?
Yeah, and I have a lot of people right now who are kind of saying, well, my horse has been in pasture all summer, but now they're going to come in and they're going to start being fed more hay. And so definitely we're in that sort of transition period where horses are, for the most part, probably still out during the day and coming in at night. I don't think anywhere this year yet has been hit so hard with the weather that horses are not going out at all yet. Yeah. But give it a few more weeks, I'm sure we'll get there. But who knows with the weather these days?
Yeah. So I introduced this topic as equine asthma. That is a term that maybe not everyone's familiar with as far as horses are concerned. We know asthma in humans and generally know what that is. People who deal with it on a personal level definitely know more. But that's not what we have always called it. In general, we call it the heavy horse. That's kind of the,
right.
When you're just talking to your horse friends, that comes from that heave line. These horses that have a hard time breathing, they'll start developing a line along their abdomen from the effort it takes to breathe. But why do we call it equine asthma? And then what is that umbrella over? And for our audience, neither one of us are veterinarians, but Claire does know quite a bit about physiology and her experience as a nutritionist. And she's taught those classes at the...
I do, yeah. I teach a class in equine health at a junior college. And years ago now, I guess it seems like yesterday, but it wasn't. I also taught equine exercise physiology. And that's where I really learned, when I was prepping to teach equine exercise physiology, that's where I really learned about airway function in the horse. And it kind of blew my mind. It was a huge eye-opener, and I'll share some of that later. But in answer to your question about the sort of equine asthma, we also used to call it recurrent airway obstruction and inflammatory airway disease. And ACVIM, which is a group of board-certified internal medicine specialist veterinarians that get together, they kind of came together and they created something called a consensus statement to sort of help guide the veterinary population as to what does equine asthma actually mean. And so for those of you that are nerdy like me and like to read research papers, there's actually an open access research paper called Inflammatory Airway Disease of Horses, Revised Consensus Statement. And in there, they do a really nice job of explaining what it is. And so I just thought I'd share a little bit. But they say horses with heaves, including those with recurrent airway obstruction and some pasture-associated recurrent airway obstruction, exhibit marked lower airway inflammation and obstruction associated with frequent coughing, increased respiratory effort at rest, and exercise intolerance. And then they also say that IAD can affect horses of all ages, so that's inflammatory airway disease, and clinical signs are usually subtle. And so I think IAD occurs in a lot more horses than we realize, and we miss it. So the subtle signs include poor performance and occasional coughing, but with normal breathing at rest. So these are not your heavy horses that are like really struggling to breathe when they're standing around like the true heavy horses are. These are horses that, maybe it's every so often when you're riding them or whatever. And I own one of these horses that has the occasional cough in the spring. When you put him into trot, he'll kind of have to clear his airway and then keep going. And growing up, and I can say like 35, 40 years ago, I remember being told, as long as they blow their nose after they cough, it's just fine. And I was at AAEP, I think it was one year, and heard a leading veterinarian in this area speaking. And she made the point that you and I should not be coughing when we run to catch the bus. Like if we have to cough because we run 25 yards to catch the bus because the bus is leaving, that's not really normal. And she was making the point that it's not really normal if horses do that either. So for those horses that kind of cough as you go up into trot the first time, that's not really normal. You should probably have your vet check that out. So they similarly have airway inflammation, but it's normally much more mild.
Yeah, and I think that like the cough should not be part of your warm-up.
Right? That's such a good point. Yeah. It is for so many people. I've been there. So no, absolutely. So they went on to talk about asthma. They said asthma in people is characterized by chronic airway inflammation in patients with a history of respiratory symptoms, such as coughing and difficulty breathing, shortness of breath, chest tightness, which vary over time and in intensity and are associated with expiratory airflow limitation of variable severity. Recurrent airway obstruction, heaves, and IAD represent a spectrum of chronic inflammatory disease of the airways in horses, resembling human asthma in many respects. Therefore, this panel of veterinarians chose to use the term equine asthma syndrome, as recently suggested by other researchers, to describe these horses with mild IAD to severe RAO airway disease. So it is this spectrum of like the very mild occasional cough here and there to the horse is really struggling to breathe on a pretty regular basis and has a lot of really obvious inflammation. And we are talking about lower airway inflammation actually in the lungs, not upper airway issues, which are completely different.
And I think at one point, at least some groups of researchers and veterinarians did refer to it as COPD, which that's kind of gone to the wayside as well. So if you're a little bit older, like some of us, you may be familiar with COPD at some point. That's under equine asthma now, though.
Right. For those who don't know, that's chronic obstructive pulmonary disease.
So we're going to talk a little bit about management strategies, but the reason this is something we want to talk about because of the nutritional management of horses with respiratory issues. And so what things can we, there's a supplement for everything. So you see, what supplement's going to fix this, Claire? Or there's some good science behind some of these different ingredients that we can give our horses that have respiratory issues. What are your thoughts or recommendations around nutrition?
Yeah, absolutely. I mean, I think the big one is omega fatty acids, right? And in particular, DHA, which I'm not going to say that one in its lengthy form, but everyone just calls it DHA because it's a very long word. Anyway, so yeah, the omega-3 fatty acids, which really help to regulate inflammation. help horses to have a much more normal inflammatory response to things that typically would cause inflammation. So that's the big one. Other sort of ingredients you might see that have potential for helping these horses, vitamin C or ascorbic acid, MSM possibly. And you'll typically see those ingredients in supplements for respiratory support. Grapeseed extract, that's another, again, just helps support inflammation, antioxidant type ingredients. Those are the things you're going to see in supplements for respiratory health. The big question is always, is there enough in there to do anything? And that's the $1 million question, right?
You've mentioned inflammation several times, and we're talking about inflammation of the lower airway. And a lot of times this gets associated with horses that are older. It's like a senior horse disease. And that's true. Like we do have, you see it more often in older horses who've had more damage to their lungs over their lifetime. But I have an example of a horse who's now in his 20s that I bred and raised. And when he was 6-8 months old, he really, really struggled with respiratory issues. At that point in time, I was like, this is a horse that for the rest of his life, I'm going to be dealing with this. And his dam had pasture-associated asthma. That's not what we called it at the time. But it was something that he obviously had inherited. And I will say, back then, I didn't know the genetic predisposition when we bred her, and I wouldn't trade him for anything. So I'm really glad that I have him, respiratory issues and all. But when I boarded him, I did have issues, or he had issues with his lung health in the pasture and when he was in stalls. But once I got him home and could manage him myself and feed him the way I wanted to feed him, he now in his 20s, you wouldn't know that he ever had any respiratory issues. So I think that is a testament to how careful management and feeding of these horses can keep them from becoming just this destiny of having heaves and being miserable when they're old senior horses and hacking around as they're warming up. So with that, we can talk a little bit about feed and management strategies. What do you usually recommend to your clients who come to you and say, hey, I have a heavy horse. How do I feed them after you've told them what to feed them?
Yeah, no, absolutely. I mean, a big one is big component of these, and I think why we're talking about this at this time of year is that when they get shut in stalls or in barns more, they're going to be in environments that possibly have higher dust kind of burden associated with them. And so anything you can do to help minimize the inhalation of dust particles, fungal spores, that kind of thing is going to really help these horses. So obviously we tend to be feeding hay when they're in stalls and not out on pasture so much. And it doesn't matter how good quality your hay is, there's going to be some dust in your hay. There's going to be hopefully only small amounts, but small amounts of mold spores in your hay, that kind of a thing. So what can we do to help these horses that have their heads in their hay? They're breathing in whatever's on that hay, and it's going to be irritating to their lung tissue. So the big things are soaking or steaming your hay. And there's research to back that up to show that really helps these horses. When you're just trying to minimize dust and mold spores, we're not talking soaking the way we soak when we're dealing with like an insulin-resistant horse. So we don't need to soak it for 30 to 60 minutes. You just have to get it wet so that all those spores expand and become heavy and can't be inhaled. And so it's a different, you don't have to soak it forever or like for that 30, 60 minutes.
Yeah. And so since you mentioned that, I think it might be helpful for you to explain why the soaking is different. So we're soaking horses hay for horses that have maybe equine metabolic syndrome because we're trying to change the hay in what way?
We're trying to minimize the amount of sugar that's in that hay. And so simple sugars are soluble and will wash out of the hay. If you soak it for 30 to 60 minutes, that sugar dissolves into the water and then is not fed to the horse. Because I think it's important to say, when you soak the hay, you soak it and then you take it out of the water and then you feed it to the horse. The horse doesn't have access to the water. All the sugar ends up in the water, and the dirt does as well, which is why it tends to kind of go brown and has a kind of icky looking color. I mean, some of that's coloring coming out of the hay, natural colors in the hay and stuff. But that's why we're soaking for metabolic horses. And so you have to soak it long enough for that sugar to dissolve. And so that sugar is in the hay. When you're soaking hay for horses with equine asthma or healthy horses where you want to protect their airway from the dust that's in the hay, you're just it's the outside of the hay that we're dealing with, right? We're just trying to get the outside of the hay wet so that any dust spores, mold, whatever that's on the outside of the hay is now swollen and so heavy that it's not going to come off the hay and be breathed in, if that makes sense.
And I guess if you do have a horse like with PPID, which is equine Cushing's, and they have a insulin resistance paired with that, you get the double benefit of you soak the hay to help them out. And then in soaking it, you're going to not inflame their airway as much. And those horses would be more predisposed to having heave or respiratory issues because of just the disease that they have and the inflammation that they have associated with that.
So, absolutely. And you can listen, we have an episode on PPID horse management that folks can listen to if they have those horses for sure. And then steaming does a similar thing, right? Steaming, you're putting hot, moist air into the hay in a special box, and it has these like metal prongs that go up into the hay, and then like you have a kettle kind of attached to it. Just think of a kettle when it boils, steam comes out of the top of your kettle, and it's doing that out of these metal prongs into the hay. So that hot, damp air is moving through the hay in the box. And again, it's swelling those mold spores and dust particles to a point where they can't be inhaled anymore. They're too heavy. They're waterlogged, basically. So
from a practical aspect, I just want to remind you that not everyone lives in Arizona. So if you live in a climate more like mine, where we do have days during the winter that don't get above freezing, how do you deal with soaking and steaming your hay?
It is hard. I mean, I think if you're in a barn, if you are in a kind of more enclosed barn environment, it's a little easier because hopefully the inside of your barn doesn't get below freezing, although it might get cold. It's not maybe going to get below freezing. People use like coolers, drinks coolers to put their hay in to soak it, and so the water doesn't get frozen. Obviously, if you just kind of spray your hay on the outside of it, maybe it won't get as frozen, but it is a challenge. I mean, let's be honest, there's a lot of people, especially if you have a heavy horse and you keep him outside still, which is ideal because then he's out in the fresh air and open air and exposed to less dust. Yeah, that's going to be very tricky. So that's where steaming becomes an option, but steamers are not cheap. So then you have that issue, although I think they're actually quite good value for money over the long run of their lifespan. If you have a horse with this condition, or if you have high-end performance horses and you're concerned about airway health, it could be very worthwhile to invest in one. If those are not options for you, then I think you're looking at other forage options. For example, feeding pellets or chopped hay. There's a number of companies out there that make chopped hay. Those can be, very good. And oftentimes they may have a small amount of oil on them or whatever to kind of increase the nutritional value or to keep dust down. And so that's a really good option. Pellets and cubes tend to be less dusty. So those are a very good option for horses with heaves as well.
And for me, with my own horse, it was feeding him on the ground rather than a rack. And I think we moved past to the point in time where we're feeding horses out of racks that are above their chest level.
Right.
That used to be super common, and that was really hard for him to have the hay dust on his nose. I also found that he struggled eating out of a trough where his whole head was in the hay, even if he was eating below him. Is that something that you've noticed?
Absolutely. And I think it's worth pointing out that is an issue with feeding round bales. Whether your horse has airway issues or not, round bales have the risk if they're just loose. I mean, we've all seen that meme of the Shetland pony that's butt sticking out of the round bale, right? Its whole head was in the round bale. I mean, now it's like just its whole head is just in this potentially dusty environment, breathing that in. So that is an issue with round bales. So one reason of many to potentially put a net on a round bale or whatever so they can't stick their whole head in the bale. But yes, I mean, ideally you should be feeding, especially off of horses that have known airway issues. Feeding off the ground is important because it's been shown to help them kind of drain all the gunk out of their airway and their sinuses and the like. So that's a really important component to respiratory management in all horses. That's how they're meant to eat, right? It's off the ground. They're grazers. And that's one of the reasons why. So that is important.
I have a follow-up question on the omega-3 fatty acids and some of the different supplementation that you can do for these horses. Is it important to do this ahead of time and be proactive, or can you use these ingredients to treat? I know treat isn't the right word, but to manage the symptoms after clinical signs after they've started?
That's a really good question. I think it's always good to get out in front of these issues. And there's certainly quite a number of research papers out there now looking at feeding different types of omega-3s and whether they actually have a substantive change on cell membranes. And that's how they're working, right? So just to back up again, omega-3 fats and omega-6 fats are incorporated into cell membranes. And so the sort of ratio of omega-6 to omega-3 has sort of different effects, and they trigger production of a number of different hormones and things in the horse's body that are either inflammatory or anti-inflammatory, to kind of keep it simple. I think it's important to note, like, we need inflammation, and we've gotten very anti-omega-6 fatty acids, but they are essential nutrients and we need inflammation. So some amount of omega-6 is really important. But omega-3s do tend to have a more anti-inflammatory action. Now, a horse's natural diet is really pretty high in omega-3s because the fat in grass tends to be fairly high in omega-3. The question is how well is that converted to the EPA and DHA that I mentioned earlier? Because those are really like the creme de la creme omega-3s. Those are the omega-3s that really have a lot of potent action in the body that are incorporated into cell membranes and really change the inflammatory response. They're the ones we really want. And converting the plant-based omega-3s into those DHA and EPA is not a super efficient process. And the enzymes that do that are the same enzymes that convert omega-6s down their metabolic pathway. And it seems as though those enzymes actually prefer working with omega-6 fatty acids. So if you have a horse that's being fed a lot of high-fat performance feed, let's be honest, in the wintertime, quite a lot of us are feeding those higher-fat senior feeds and performance feeds to try and keep weight on our horses. We've really swayed that diet heavily towards omega-6s, and we've maybe made it hard for the horse to convert plant-based omega-3s that might be in its diet. So maybe you're somebody who's supplementing flax, but if you're also feeding a high-fat performance feed, your horse is going to have a harder time converting that flax-based omega-3 to the end products we need than if you didn't have all that high-fat performance feed. And I'm not saying get rid of your high-fat performance feed. Absolutely not. I love high-fat senior feeds and high-fat performance feeds. I'm just saying that in the face of that, and especially if you have a horse that has inflammatory issues like equine asthma, it really makes sense to give them a source of DHA and EPA directly because you cut out the need for all that conversion to happen and you're just giving them the end thing. And there's lots of nice research studies showing changes in cell membrane structure, red blood cells and the like, that supplementing DHA and EPA directly has a much greater effect on the composition of like red blood cell membranes than when you just feed flax, for example. And it takes a while for that to happen. So I've gone off on a huge tangent. But to come back to your question, if you want to really affect those cell membranes and make them able to withstand inflammation, obviously that's going to take some time to do that. And so yes, starting ahead of time. So like if your horse has been out on pasture all summer, you're about to bring it into the barn and subject it to a dustier, more triggering environment, I'd probably be starting that good quality omega-3 DHA EPA supplement maybe back in September, but definitely now.
Yeah. So I keep waiting to hear you say fish oil.
Yes.
And it always it blows my mind that this is where the best source is for DHA and omega-3s for horses, because to me, as just a lay person, I have a hard time wrapping my brain around it. So if you could explain to us why we supplement fish oil for our horses rather than maybe the flax-based oil.
Yeah, and I think you just did a nice job of it. I mean, the fish oil really has that end source. So what's happened is the fish have consumed plant material and whatever, and they've converted it themselves into the EPA and DHA you need. So then when you harvest those fish and you use the fat in the fish that you've harvested, it tends to be higher in the DHA and EPA. Most of our higher content DHA and EPA horse supplements that are out there, oils, have some amount of fish oil in them. Algae is also another source of those omega-3s. It's harder to find algal supplements, but they are out there. And again, the trick is, do you have enough? There's a lot of products out there with a tiny amount of DHA and EPA in them. The research really suggests that to really have an effect on cell membrane structure, you're needing probably at least half to a gram per day. So that's like 500 to 1,000 milligrams.
So besides the omega-3s, what amounts of some of these other ingredients would you recommend?
Yeah, I mean, for the ascorbic acid or vitamin C, horses do make their own vitamin C from glucose in their liver, but there's some interesting research showing that ascorbic acid is actually low in the plasma, in the fluid of the lungs in horses that have recurrent airway obstruction. So it's possible that those horses can benefit from some additional vitamin C. And the suggestion from that research is 30 milligrams per kilogram body weight per day. So to put that into sort of everyday terms, that's about 15 grams for an average sort of 1,100 pound, 500 kilo horse. It's a lot more than most of your supplements out there maybe give you 4 or 5 grams a day. One caution I want to put out there about vitamin C is if you do supplement vitamin C to your horse and you maybe decide to do it seasonally and then decide to remove it, you need to remove it slowly because you can shut down their own production or limit their own production. You don't want to go cold turkey off of it. So you want to remove it slowly if you do that. And then as far as MSM, I haven't seen a lot of research on amounts of MSM, but I think the amount that you get seen being fed often is sort of 10 grams per day. So I would say that that's probably an amount of MSM if you want to supplement that.
So we have our horse. We've worked with our vet if we needed to for a diagnosis and for medical treatment if that's necessary. We are supplementing with a good omega-3 fatty acid supplement. We have some vitamin C in there as well, some MSM. We're feeding our horse on the ground. We might be steaming or soaking that hay or wetting it down so that it's not so dusty. They're not eating in a trough with their head in the dust. So we've got all of that managed. But what about the barn? Because we've moved these horses in the barn. And on those cold days, we're closing the doors. And this is one of those things where I waited a long time, finally built my barn. And then it was finished. And it's summer. I'm like, why do I even need this? But then winter comes and you remember, oh yeah, okay, so we did need this barn. But why is ventilation so important for our horses when they're in the barn, especially during the winter?
Yeah, I mean, I think we've touched a little bit on the dust factor, right? I mean, it's having that fresh air, but I think the big thing that we haven't really talked about yet is ammonia buildup. And, having clean air to breathe is really important. And I mean, not just for your horses, but for you while you're working in the barn too. And so, yeah, ammonia is a big issue in barns that are closed up and don't have adequate ventilation.
Yeah, and truly, when you walk into a barn, you should not be able to smell ammonia. We think of it like that urine smell, that really sharp, harsh scent that we often have in our barns. That shouldn't exist. If you can smell it, then it's damaging for you and your horse, from what I understand.
Yeah, I mean, I think that's that sharp smell. The reason it smells sharp, it's like it's burning. I mean, it's an irritant. It's actually irritating your airway and your lung tissue. It's a caustic gas. And so it's going to be irritating your horse's lung tissue too. And, I said earlier, I used to teach equine exercise physiology. And one of the reasons I became really passionate about airway health is one of the things we covered in that class were conditioning programs and how you condition various systems of the horse to be more effective and efficient and reduce injury risk. So, you can work your horse and you can make their muscles stronger and give them more power, and you can teach them to be more agile and what have you. And doing skill work, you can, the heart is a muscle. You can make the heart stronger so it pumps more blood at greater volume around the body to deliver nutrients and oxygen to muscle tissue. You can condition tendons and ligaments to a certain extent to make them stronger and resist injury. But your airway, there's not a lot you can do to improve airway function. So your airway is the airway you have. And the reason it's so important to performance horses is that you need the oxygen you're bringing in to then be able to metabolize all of your carbohydrates and fats. When we talk about oxidative metabolism, in order to get energy for the horse to be able to function and contract its muscles and the like, those require oxygen. Well, where does oxygen come from? The only place it comes from is you breathing it in. So you breathe in that air that has oxygen in it. That oxygen exchanges across the lining of the lungs. The lining of the lungs deep in the alveoli is like, 1 cell thick. It's easy for that oxygen to transfer across and the carbon dioxide that's in your blood to get out. So if you don't get that carbon dioxide out, then you're going to become acidic, and that's going to affect their ability to work as well. So anytime you have inflammation in your lung tissue or mucus or anything that makes that more than 1 cell thick, you're making it harder for those gases to transfer across in and out of the bloodstream. And therefore you limit the availability of oxygen to your muscle tissue, and you limit that horse's ability to work aerobically and conduct the work that you're wanting them to do as a performance horse. So this is why horses, when they gallop, they stretch their head and neck out. It's because it makes that airway pipe longer and straighter, and you get less resistance of the air going down their airway into their lungs. So they're trying to minimize airway resistance. And so anything that puts mucus in the airway is increasing airway resistance and limits performance. So it's really important. Your air quality in your barn, I mean, we just don't think about it, but it's really important, whether it's dust, mold, fungus, ammonia, all these things can damage the airway. It may be lasting damage. Once you damage your lung tissue, there's not much you can do to improve it.
So ammonia comes from the urine and the manure, more so from the urine, I would think, than the manure. You can correct me if I'm wrong on that.
No, that's correct. Yeah.
Yeah. And I've seen some research that shows that stalls that are bedded with wood shavings are better than straw. You have higher levels of ammonia in stalls that are bedded with straw. What other strategies do we have for limiting or removing ammonia from our horses' stalls?
Yeah, there's quite a lot of research out there. Folks can search online, but you're right. Shavings is better than straw. Straw is one of the worst, and not just for dust, but for fungal spores. There's some really interesting research showing that fungal spores from straw can get in the lungs and will cause IAD and asthma. Shavings is better. There are some other things like peat that have been shown to be even better still, but most people don't have access to peat, and it's not very renewable, and it's quite dirty. So things like paper bedding, cardboard. There's some interesting like miscanthus, or what's the word I'm thinking of? All I can think of is CBD, but where does CBD come from? Hemp. Thank you. Hemp bedding, Claire, hemp bedding. Hemp is also a really good bedding, very dust-free, highly absorbent. So that's another good option too. But there's definitely lots of information out there on the internet. And then there are things that you can put on the floor. I mean, you've probably seen like the zeolite products. So these are things like Sweet PDZ, I think, is the one that's been around for decades.
Yeah, that's the one I use.
And then I know Stanley have one as well. The name is escaping me off the top of my head. But these are absorbent powders that you put on the ground, and they absorb the urine and kind of prevent that ammonia from being released into the air. And you put your bedding on top of them.
And I just got finished saying that I feed my Jack on the ground so that he doesn't have dust falling into his nose, and that's been a really important part of his management. Unfortunately, he would be horrified at the idea of peeing or pooping in his stall. He's very tidy and he has a run, so he does all that business outside. But he's a keeper. But it's something to keep in mind. If your horse is messy in the stall and you're feeding them on the ground, then they're going to be eating closer to the ammonia. So you might be doing something that's better for them that ends up just being worse for them if you aren't able to manage the ammonia and lower those levels, especially when they're eating. But, if they're in the stall, they're picking through bedding, so their head's going to be down. It's just,
right, for sure. Yeah.
So the other thing for me is having seamless mats. Yeah, not all of my horses are as tidy as Jack. So we have a couple mares that, I shouldn't just blame it on the mares, but my husband would, and he helps clean stalls. But having the seamless mats, so there's no way for urine to get under the mats and get trapped.
Yeah.
The mat goes all the way across and then attaches at the wall. And so that has been a huge difference, because in the past, being in barns that have mats, you pull the mat up and there's urine under.
Right.
Yeah. So that's something that if you're able to do that or have that luxury, it's something that was really important to me. It's why it took so long to build that barn, because I had to save up for all the
right, all the nice things.
All the things
I know.
that I had to have. So that's something that I would recommend. And also frequent cleaning. You have to clean daily.
And on the cleaning, okay, can I just cover my pet peeve? Yeah. I have a total pet peeve.
You're a pony clubber. Yeah.
Well, no, it's not even a pet peeve. It's just a pet peeve of mine. I go into barns. I mean, I can't tell you how many barns I've been in, and I'm there like late morning and the crew are getting wrapped up for the day, and they're going down the barn aisle with the leaf blower. And oftentimes I can't even get out of the way. I remember being in one place and I leapt into a tack room and shut the door because I just stood there waiting for them to be done, because I get allergies, and that's one sure way to trigger my allergies is to blow all that dust around while I'm standing in the barn aisle. But all the horses are standing there, heads hanging over the stable doors, and the guy's going down the thing, with the leaf blower, and just terrible for airway health. Awful. So that's one of my pet peeves.
And I would add, for me, one of the things that I had to change was sweeping in the barn. I always liked, the horses are in, I'm done with chores, I'm going to sweep up, because I just like that time with them while they're munching. And I don't know, it's kind of meditative. And it's one of the reasons we like having horses at home, when we can do that. But when I was sweeping, it was raising dust. And so I'm like, okay, no. So I've changed that so that any sweeping I do is after the horses are out so that they aren't in the barn while I'm sweeping.
So if you are turning horses out, save your leaf blowing and sweeping, until they're turned out.
And then for the ventilation piece, keep the doors and windows open. You probably aren't going to change the temperature inside the barn that much unless you're protecting from wind. And so if you can keep things open, it's not like your cozy house where you can go in and stay nice and snug and warm. The horses are out in the weather unless you have a heated barn. That's a whole different beast.
Right. And I think drafts are what you really want to avoid. Right. So that's what's going to make horses cold, is having a draft of like moving cold air blowing across them. So figure out, like, are there combinations of windows and doors you could leave open that would help the barn be a nice temperature, but you're not going to get that drafty air movement over horses. So that can just take some experimenting with how your airflow is and which direction your weather comes from and all that kind of thing.
So then I think the final piece of this, protecting our horses' airway, especially during the winter, I mentioned in the introduction, is the arenas. So we are more likely to work our horses inside during the colder weather. And you have dusty arenas that can be hard on their respiratory health. It's challenging because in our area, for example, with the freezing weather, you run water and it's just hoses and freezing, and it's such a challenge. But it is really important to keep the dust down. There's different products that you can use that help retain water or moisture in the footing. So that's one thing.
Yeah, like the magnesium dust suppressant products and those kinds of things. Yeah,
magnesium chloride, I think. And also there's like the woe dust and slow dust are two different products that they bind or keep water in the footing. That's another one that I have an outdoor arena, not an indoor, where I board during the winter. They use one of those products and it really does help. So all the thing about airway disease in horses is all these different things add up to make it worse. And so as much that you can control and manage as possible, the better your horse is going to be.
For sure. I mean, as we said, the fish oil DHA supplements are great, but if you don't make any associated management changes, it's like, it's not going to be as effective as it could be.
Yeah, and I think anyone who talks to their veterinarian, they're going to tell them the same thing. We can treat medically, but you have to make changes to management if you really want to protect your horse in the long run.
Yeah.
And if you don't take care of it now, it's going to get worse as the horse ages, and it becomes a welfare concern. So,
and I think it's really important to say that obviously this is very important if you have a horse that already has airway issues, but not managing air quality in your barns and the like, is going to have a negative effect in the healthy horse that doesn't have airway issues. And as you mentioned, it could lead to airway issues down the road. So I think this really is applicable to everybody who owns a horse and kind of keeps them in winter. And, we have the inside, dust horses now that suffer from the airway issues. And then, in the spring, we have the pollen-triggered horses when they go out. And maybe we'll do an episode on that in the spring. But, it's definitely a seasonal issue at this time of year with the horses coming in to barns and having that air quality component.
Yeah. I have a follow-up that I meant to ask when we were talking about ammonia, Claire, if you don't mind.
Sure.
So the ammonia and alfalfa piece. So that's something people always, I can't believe we missed it. We're a nutrition podcast. Oh. So it seems like horses that have alfalfa, they have a more pungent urine. Is that true? And is there anything we can do about that?
Yeah, I don't know that it's that their urine is more pungent, but they are creating a lot more urine, right? So alfalfa is known for being higher in protein, and generally, if you're feeding your horse a lot of alfalfa, you're probably greatly exceeding its protein requirement, and your horse can't store that excess protein. So all the amino acids that make up protein have nitrogen in them, and you can't store that nitrogen anywhere if you don't need those amino acids. And so they get broken down and excreted in urine as urea. And so then you have all that nitrogen in your urine, and then, microbes in the environment interact with the urine, and that's what releases the ammonia, right? And you end up with ammonia. So if you have horses eating high protein diets, they're going to be drinking more, they're going to be urinating more, and you're going to have a lot more ammonia in your atmosphere as a result of that. So yeah, I can smell barns that feed a lot of ammonia as I walk into them. I mean, it is, sometimes the worst ones make my eyes sting.
And that's so hard on the horses being in that. If you are feeding alfalfa, besides cleaning the stalls more frequently, which I think you just have to do because they pee more, is there anything else that you can do, or is it just...
No, I mean, it's one of the reasons why I generally don't feed more than about 25-30% as the forage intake as alfalfa. Then you get the best parts of the alfalfa benefit without having that excessive protein that just ends up as ammonia and urine in the environment. So, and you're going to spend more money on bedding. It's going to take your staff longer to muck the stalls out. You're putting your staff health at risk with more ammonia exposure. It just kind of, there's a big long list of reasons why it's not brilliant to feed excessive amounts of alfalfa. Now, there's going to be that horse that needs to be fed straight alfalfa, and I totally get that, and I have those clients, and that's fine. But for the majority of horses, they don't need to be fed that much alfalfa.
Yeah, but there is a lot of benefits to the forage in certain instances, and we did talk about that in episode 1. That's the first thing we talked about.
That's very true.
So if people are interested in more about alfalfa, they can go listen to that episode. But for now, that's all the time that we have. Thanks, Claire. We kind of went roundabout, but I feel like we hit the important parts. If you're listening and you have questions about what we're talking about, you can send us a message at info@scoopandscale.com. That's scoop and scale spelled out, and we will receive those messages and try to answer them in a future episode. You can also find Claire at clarityequine.com.
And make sure to subscribe wherever you listen to your favorite podcast. We always love it when we get new subscribers, and share with your friends, share it on social, do all the things. It means a lot to us.
For the Scoop and Scale podcast, I'm Michelle Anderson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.